Good morning and welcome to Webinar Wednesdays with Senior Medicare Patrol. We're happy to have you all join us this morning. My name is Sunny Lawless and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. And joining us this morning will be Brandy Lacey, who is our Community Outreach Specialist in Mississippi, and Shay Lewis, who is a Community Outreach Specialist in Georgia. Today, for the August installment of Webinar Wednesdays with SMP, we're going to share information on home health and hospice fraud and scams. Now, during the presentation, you're welcome to type any questions you might have into the chat, and we'll hold those until the end of the presentation when we open it up for Q&A. Before we get started with today's presentation, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services, as part of a financial assistance award, with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. And if this is your first time joining us for a webinar, we want to give you some information about the Senior Medicare Patrol program. SMPs are grant-funded projects. Every state has an SMP program. In Georgia, Louisiana, Mississippi, and Vermont, the SMP programs are sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Before Brandy gets started with the information that we have to share with you today on home health and hospice, we do have a quick polling question. And today's polling question is, do you know the differences between home health and hospice care? And if you'll give me just one moment, we'll launch the poll. All right, so go ahead and we'll give everyone a few seconds to lock in their answers. Do you know what the differences are between home health and hospice? All right, and we'll give it about 5 more seconds for everyone to lock in their answers. All right, so it looks like 93% of you know the differences between home health and hospice care, and about 7% don't. And that's good. So what we're going to do is I'm going to turn things over now to Brandy, who is going to share what the differences are and tell us how fraud and scams might occur with each. Brandy?
Thank you, Sunny. There are several differences between home health and hospice care. In addition, there are some similarities that make it difficult for people to tell the difference between the two. Today, we are going to look at those differences to get a better understanding of these two types of care services and learn how to avoid becoming a victim of Medicare fraud. Next slide. Home health is defined as a wide range of healthcare services that can be given in your home for an illness or injury. Next. Medicare covers most home health services that are considered reasonable and necessary for the treatment of an illness or injury, usually after a hospital stay. The home health agency must be deemed Medicare certified. Home health agencies work with your doctor to evaluate your healthcare needs and tell you what home care services you need. To be eligible for these services, your doctor must certify that you are homebound and require at least one of the covered services. Next slide. Home health is for individuals who are expected to recover from either the illness or injury for which they are being treated. Some of the services that are covered by Medicare are skilled nursing care on a part time or intermittent basis. This care must be performed by a registered nurse or a licensed practical nurse. Physical therapy, speech therapy, and occupational therapy. Home health aid services on a part time or intermittent basis to assist you with things such as bathing, using the bathroom, or dressing. Medicare will not pay for anyone to assist you with household chores such as vacuuming or washing clothes. Next slide, please. Other covered services include durable medical equipment such as walkers, wheelchairs, or bedside commodes. Certain medical supplies like wound care dressings that are ordered as a part of your care. Next slide, please. Now we will talk about hospice care. Hospice is a special way of caring for people who are terminally ill. Hospice care involves a team oriented approach that addresses the medical, physical, social, emotional, and spiritual needs of the patient. Hospice also provides support to the patient's family or caregiver. To qualify for hospice care, a hospice doctor or your personal doctor must certify that you are terminally ill, meaning you are not expected to live for more than 6 months, as well as you must be homebound. When you agree to hospice care, you are agreeing to comfort care, also known as palliative care, instead of care to cure your illness. You must also sign a statement choosing hospice care instead of other Medicare covered treatments for your terminal illness and related conditions. Next slide, please. Coverage for hospice care may include the following: all items and services needed for pain relief and symptom management, medical, nursing, and social services, medications for pain management, durable medical equipment for pain relief and symptom management. This may be things such as wheelchairs, electric hospital beds, bedside commodes, etc. Next slide, please. With hospice care, you are acknowledging that you are not going to get better, and therefore the focus is on giving you the best quality of life possible given your condition. In this case, you may have an aide come in to assist you with bathing, going to the bathroom, and other personal hygiene care that you need. Hospice care also allows you to have homemaker services. This is someone who will assist you with things such as light housework, changing your bed, and washing your clothes or dishes. This is one of the differences between home health care. Next slide. Now that you know more about home health and hospice care and coverage, we're going to talk about the different types of fraud that may occur with these services. Next slide. The most common healthcare home health fraud scheme is when Medicare is billed for services such as physical, occupational, or speech therapy that were never actually provided. The beneficiary is asked to sign a blank form during a home visit. This allows the agency to then bill Medicare for a variety of services that were never provided. Unscrupulous physicians may also fraudulently certify that a beneficiary is homebound when they are not. Sometimes the beneficiary is offered cash or other incentives to sign forms and allow the physician to charge Medicare for services that they did not perform. Another example of home health fraud is when Medicare is billed for skilled nursing care, but such care is not provided at all. Instead, the provider sends someone to the beneficiary's home to help with housekeeping and errands, but bills Medicare for skilled nursing services. Next slide. Hospice fraud occurs when Medicare is falsely billed for services that are defined as hospice care. Examples of hospice fraud include A provider enrolling a patient in hospice care without the knowledge or permission of the family or the patient. A provider falsely certifying that the beneficiary is terminally ill, expectancy of 6 months or less if the disease runs its normal course. A provider billing for a higher level of care than needed, or provided or billing for a service that were never provided. A provider keeping a beneficiary enrolled in hospice care for long periods of time without any medical justification. Providing inadequate or less care on weekends and disregarding a beneficiary's plan of care. Next slide. To avoid becoming a victim of home health and hospice fraud, keep these tips in mind. Never sign a blank form from your home health or hospice provider. Avoid offers for gifts or cash in exchange for your Medicare number. Watch your MSN and EOB to make sure Medicare has not been billed for home health or hospice services that were not provided. Only agree to home health or hospice services if your doctor has certified you to receive those services. Next slide. Now I will turn things over to Shay, who will share the 3 keys to success in preventing fraud, errors, and abuse.
All right, thank you, Brandy. Good morning, everyone. We're going to go ahead and get started with the 3 keys to success in preventing fraud, errors, and abuse. Next slide. The first key is to prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Want to keep these tips in mind. Only share your Medicare number when necessary, such as the doctor's office or the pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask you for your Medicare number for any given reason. And keep records of all of your medical visits and procedures that take place and medical equipment ordered. Next slide. The second key is to detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. You want to review your Medicare summary notice, as we call it MSNs, or your explanation of benefits, your EOBs. Your Medicare summary notice is mailed to you by Medicare every 6 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive your healthcare services. Compare your statements to your personal records and look for the following items: medical appointments that you did not attend or may have been double billed for, medical equipment such as braces, catheters, or diabetic supplies that you did not order or receive. Next slide. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are just some quick steps to report suspicious behavior. One, if you suspect or receive a suspicious call, do not give out any personal information. Report the call immediately to SMP. Two, if you have any questions about your medical statements, you want to go ahead and call your healthcare provider or your plan. And three, if you aren't comfortable calling your provider or just isn't satisfied with their response, go ahead and call SMP at our toll-free hotline number 877-272-8720, which is on the screen shown. In addition to reporting fraud using our toll-free hotline number, you can also visit our website at www.stopmedicarefraud.org and click on the orange Report Fraud button. Next slide. Please keep in mind that Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basis of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, all volunteers participate in bi monthly webinars and various training opportunities throughout the year. Volunteering for the SMP program is extremely flexible and is done on an as needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something that you might be interested in, you can give us a call at our toll free number and we will send you a volunteer information packet and answer any questions that you might have about the process. Next slide. Want to stay up to date on the latest scams impacting older adults in our community? Well, come on by and just scan our beautiful QR code using the camera on your cell phone to be guided to our social media platforms, including Facebook, which we have one for Georgia, Louisiana, Mississippi, Vermont, and our Spanish Facebook pages as well. YouTube and our podcast, which is called Sip and Learn with SMP on Spotify and Apple Podcasts. Our state's specific S&P Facebook pages, especially, are a great resource for older adults and their care partners to find out about the hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next slide. And as mentioned in our previous slides, again, we have a toll free number at 877-272-8720 that you can call to report potential healthcare fraud or just to simply ask us some questions about potential fraud or to even request that we attend for your event or speak to your group about our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach the older and disabled adults within the community. Additionally, you can visit our website at www.stopmedicarefraud.org for more information about the SMP program within the state. Our website can be viewed in multiple languages by just simply adjusting the language tab at the top right part of the screen.
All right, thank you, Shay and Brandy, for the information shared with us today on home health and hospice fraud and scams. Keep in mind, coming up next month, we're going to be preparing everyone for open enrollment. So, our entire month of September is dedicated to discussing open enrollment, fraud, and scams. So, our next Webinar Wednesdays program is going to be on Wednesday, September 30th at the same time, 10:30 Central, 11:30 Eastern. And we're going to have a fraud-free enrollment, your benefits, your rules. So, we hope to see you all again then. All right, so moving on to our prize drawing. If you were registered to join today's webinar prior to 10:15 this morning, your name has been entered onto our prize wheel to win a $25 Amazon e-gift card. So if you'll give me just one moment, I will open that up and share that with you all. Okay, let's see. And you do have to be present to win. All right, let's go ahead and give it a spin and see who our winner is today. All right, let's see. Let me check my list real quick to see if Miss Elsie was able to join us today. And I don't see her name, so let's try again. All right, Miss Joy, congratulations. I do see you here today, so I'll be reaching out and we'll make sure that we get you that gift card later. So congratulations. And let's make our way back to our slides. There we go. All right. Well, thank you all again for joining us today. But before we wrap up, we do want to open it up for questions. So if there's anything that you would like to ask about the SMP program or on today's topic, you can raise your hand and we'll unmute your line and you can ask your question. You can also, if you prefer to type it into the chat, you can do that as well. We'll give everybody just a moment to do that if they're interested in asking a question. All right, well, I'm not seeing any hands raised, so this is going to conclude our presentation today on home health, hospice, and fraud. Home health, hospice, fraud, and scams, excuse me. So we will be sending an email out to everyone today, just thanking you for joining. And there is a link in that email to fill out a short survey. And we would really appreciate it if you would just take a couple of minutes to let ACL know how we did with today's presentation. We appreciate you all joining. Thanks again to our presenters, and we hope to see you all again next month. Everyone take care.